most important piece of information in a lecture is the title itself.
Price ranges from £300 to £700, depending on the material they're made from.
You must not allow failure of this kind to discourage you, however. If I take notes on my notebook, I can't concentrate on the lecture.
At first, I think you need some like-minded friends.
Firstly, you have to understand what the lecturer says as he says it. I quite enjoy the life here, except for the difficulty I have in the lectures. It's a good idea to taste the tasty dishes in one of the restaurants.
If you're doing it correctly, it's a great calorie burner.
Maybe many can't understand your passion for the dangerous sport.
It's known for its excellent cuisine and warm Australian hospitality. You don't have to wait until you're in a crisis to come and seek help. Taking the time and space to reflect in the supportive, private and comfortable environment that the counselling service offers you is an effective way to move forward positively in your life.
Is it possible if I prefer a separate waiting area?
Yes. We'll take account of any special requests you may have to protect your confidentiality. The record of your name and other basic information is kept for statistical purposes. Any notes written down about you are identified by a number. No personal information is kept on the computer.
How do I know what particular counselling I need to balance myself?
Well, as you've noticed, when you approach the service for counselling, you will be offered an initial half-hour assessment interview with one of the counsellors. They can answer any questions you may have and help you to assess whether individual counselling is the best way forward for you. It is the initial assessment interview. If it is thought appropriate, a referral can be made to a variety of medical, therapeutic or psychiatric services in the community, or we can just begin weekly counselling sessions.
How do I make an appointment if I need regular counselling?
If you decide to proceed with regular counselling, you will be offered the first available appointment.
Fluorine is the 13th most abundant element on the planet. It's in seawater. Foods like fish, tea, and gelatin contain it, and it is a naturally occurring substance in minerals. That is to say, it's in all of the rocks, because it's everywhere. Fluorine is washed into the water supply during erosion, and then we drink it. Fluoride is just fluorine with an extra electron, and when we see it in toothpaste, food, or drinking water, it's actually sodium fluoride, or in our bodies, it's calcium fluoride. In the 1940s, scientists found that people living near natural water sources with 1 part per million of fluoride had fewer cavities. So they decided to add fluoride up to that concentration to reduce cavities for people who lived elsewhere. Unsurprisingly, controversy ensued. Today, 2/3 of Americans have fluoridated public water, but studies have thrown into question the benefit of waterborne fluoride compared to topical fluoride, or toothpaste with fluoride in it. A study of 23,000 skeletons from medieval archaeological sites found that people who lived near the coast and consumed fluoride-rich fish had fewer cavities. Another CDC study compared kids in the late 60s to kids in the early 90s and found a 68% drop in cavities over that time, perhaps due to fluoridated water, but it could have also been fluoride toothpaste. In the right concentrations, 0.8 to 1.2 parts per million, fluoride reduces tooth enamel solubility during its formation, helping it solidify and form teeth that are more resistant to bacterial attack. After the enamel is formed, though, fluoride helps prevent bacteria from producing acid,
When a traumatic injury happens, effective medical care is crucial. Improper treatment of any joint injury can cause permanent loss of flexibility and reoccurring joint pain. As quickly as possible, the doctor applies ice packs to your injury. Ice deters swelling and inflammation, so you feel less pain. After keeping it iced for the first 48 hours after injury, the doctor begins therapeutic exercise of your wounded joint. Recently, a new treatment for degenerating joints has been developed, which is a product called orthokin. The treatment involves combining healing proteins with a sample of the patient's own blood. The injured joint then receives an injection of the mixture. This new technology stimulates our own white blood cells to produce large quantities of protective protein. Our cells make this protein naturally, but not in sufficient amounts to protect the damaged cartilage in our joints. It also has the advantage of convenience and lack of side effects. Here are some suggestions on how to prevent sports injuries. Use appropriate protective equipment. Maintain proper lighting in the training area. Have adequate rest. Avoid alcohol and drugs in order to prevent injuries. Follow a regular fitness training program to improve overall coordination and endurance.
What is the name of the bird that cannot fly, and is the native of Antarctica?
What is the synonym of genuine, starting with the letter A? How can one cut the fruits at home? Water is a mixture of oxygen and
In C and G, what is N? If something is brought to halt, what is current position of the object then, stopped, or moving? The term fracture is related to bones or muscles.
If a party is organized for the newcomers in the college, then what do we call it? Freshers or farewell?
being trustworthy is a positive or negative quality.
What is the term used for the severe lack of nutrition?
What is the synonym of lack, starting with the letter D?